Pro Group Management, workers' comp that works for you.
Welcome to an all-new Nevada Newsmakers. Sam Shad's on assignment. I'm filling in. My name is Mike Draper. We've got a very special show today with Senator Angie Taylor, Governor Bob List, and Matt Patterson, the founder and president of WelbeHealth. We'll be talking about elderly health, so stay right here and tune in.
The 13th annual Nevada Newsmakers Goes to Washington is brought to you by Pro Group Management, workers' comp that works for you. NV Energy proudly serves Nevada, providing electricity to 2.4 million electric customers. The Nevada Mining Association, mining a better future for Nevada. Silver State Government Relations, we know Nevada, so you don't have to. And University Medical Center of Southern Nevada, offering the highest level of care in Nevada.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
Welcome to an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. I have a very esteemed panel today. We have Senator Angie Taylor, the 24th governor of the great state of Nevada, Bob List, and Matt Patterson, the CEO and co-founder of WelbeHealth. Thank you all for joining us this morning.
Thank you for having us, Mike.
During this last legislative session, I watched you very passionately advocate on behalf of a bill, SB 209.
207.
Or 207, sorry, and wanted to ask you a little bit about that bill. Can you explain to us what that bill was about and what you were trying to accomplish?
No, thank you, Mike. It's really an honor to be able to talk about this. This is really one of the highlights of my session for me. I mean, what Senate Bill 207 did was it didn't create a PACE program. That happened, I believe, during the 209 session assembly bill that was passed by Assembly Member Sheila Leslie at the time. It created a PACE program. A PACE program, in a nutshell, is all-inclusive care for seniors, in particular low-income seniors, primarily those who are on Medicaid, and the vast majority are on Medicaid and Medicare, but it gives them a one-stop shop in 11 different areas, whether it's transportation, whether it's care at home, medication, the socialization, behavior health, all of these in a one-stop shop program, really for seniors. Many of them are by themselves, don't have family members who can assist, or family members who work. Right, and so our law said that we could have, right, we may have a PACE program here in the state of Nevada. Initially, statute said that, but Senate Bill 207 really said that we will have a PACE program, and so that's why it was really, really important.
Yeah, that's huge. Governor, from your perspective as a former governor, how has Nevada's approach to elder care evolved over time, and why do you think right now is the time for a program like this?
Well, it's as the state has grown, new innovative programs have been brought in, but this one is, I think, a giant leap forward because it enables people who are qualified to be in a nursing home, but don't want to be in a nursing home, which is an awful lot of people. It allows them to stay at home and basically get the same services that are otherwise provided in a nursing home. They can have their transportation to the dentist. They can have transportation to their doctor. There's a hub where they can gather and participate in social activities, have food, have medical care, have a gym, and fraternize and socialize, and then go home whenever they wish to do so. And it's a wonderful dimension for Medicaid participants.
Now, Matt, you're on the front lines of elder care, and I'm curious what gaps in the system or exist in the system right now that you think PACE is uniquely positioned to fill?
Yeah, well, I mean, my background as a physician, I was a U.S. Navy doctor, and working in PACE is an absolute dream from the standpoint of being a clinician, because it's a program where all the incentives are aligned to do the right thing. And it's all about making life better for the participant that we serve on the terms that they want it served. I think that the key gaps that PACE has a 50-year proven track record of addressing is to provide a very integrated and coordinated model of care for both medical and social services. A lot of these services may exist ad hoc, but it's oftentimes up to a very vulnerable senior, or perhaps their caregiver, their son or daughter or caregiver, loved one, to try to navigate this very, very complex system of services and care and try to put it all together in a schedule and payment that makes sense. PACE, as the senator so eloquently put, is one-stop shop. It has everything that you need: comprehensive medical and social services, does everything that a frail senior needs to stay home where they want to be and out of institutional care. And with a growing population of elder adults who need supportive services, it's really a critical and proven gap in the model of care.
Now, Matt, Senator Taylor touched on this. What are the differences between the PACE program and your traditional Medicare or senior care type program?
I think the biggest difference is that it is an integrated payer and providers. It is the health plan as well as all the services that you need all in one package. And then those services are highly coordinated. So there's an actual PACE location where participants can come and have everything that they need: primary care, PT, OT, socialization, food, personal care, behavioral health, everything you could possibly think of. But then when they're home, the PACE program follows them 24/7, home health, home care, assistance in the home, transportation to and from all the appointments, delivery of medications to the door. So there's really no other model out there like this. And so it's really one of a kind when it comes to the comprehensiveness and the integration coordination of care.
Senator, I watched during some of the hearings and your testimony and presentation of the bill. It seemed like this bill is a very personal bill for you. What drew you to SB 207 and pushing the PACE program? And why is this a solution worth pushing in Nevada right now?
Thank you for that question. I was thinking along the personal lines, right, Mike, as I was listening to the doctor and the governor speak. It began honestly with a conversation with Oscar Delgado from the Community Health Alliance, and looking at healthcare is one of those things that's always been high on my list. Just as a public official, as a breast cancer survivor, it's been something personal to me for obvious reasons. So having a conversation with him in terms of what are some of those gaps, and we just began to talk about my mom. I'm the caregiver for my mom, and we began to talk about those opportunities for people such as her, right? And what we could do to better serve that population in our state, because we have a growing population, right, in Nevada, with having no state personal income tax. It's a place that draws retirees, and so that population, as Matt said, is growing. I mean, I get so excited when I think about the seniors and how I believe this extends their life. It gives them a greater quality of life, keeps them out of the nursing home. And because I know my mom is like, I want to stay home as long as I can. That's a better quality of life for them during this phase and during this chapter.
I Couldn't agree more, and I'm excited to get into the program a little bit more. We'll be right back on an all-new episode of Nevada Newsmakers.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
Hit the road in style during the $150,000 Roads to Riches giveaways at Tamarack Casino. Win up to $5,000 every week and a top prize of a 2026 Chevy Traverse or $40,000 in cash. It's the $150,000 Roads to Riches giveaways at Tamarack Casino.
This is Nevada Newsmakers.
Welcome back to an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. We have a very special panel today. Governor Bob List, the 24th governor of Nevada, Senator Angie Taylor, and Matt Patterson, the CEO and co-founder of WelbeHealth. We're talking about SB 207, which implemented the PACE program geared at elderly care in our state. Governor List, I've got a question for you. How does a PACE program improve the quality of life for seniors while potentially reducing state healthcare costs?
Well, right now, the way it's been in the past before the PACE program is being set up, is that lots of Medicaid patients really had no choice but to go in a nursing home. The family simply was unable to care for them. They could not get the services that they needed, and they were pretty desperate and wound up in a nursing home, oftentimes because they didn't want to be there. They really much preferred to be in their own bed, in their own home, and around their own family. And when they reach the point where the family can no longer provide for them or take care of them, that's where they wound up. And so this is a major step forward, that these folks will be able to be in a nursing home, be in their own home with their family, with those who love them and care for them, and get all of this help from this program that will provide the same services they would have received in a nursing home. And so it's a huge, huge step forward that people couldn't have had, would not, and haven't had in the past. And as Nevada has gotten larger and larger, many times with elderly people moving here to retire, there's a greater and greater demand for it. And to turn to the financial part of it, it's cost the state and the federal government significantly less money to do the PACE program than to pay for them being in a nursing home. So it's a win-win thing for the individual participant, for the state, and for the federal government and the taxpayers.
Matt, from a policy and design perspective, how is PACE funded, and how sustainable is it for Nevada's long-term healthcare system?
Yeah, I mean, the thing that's important for your listeners to grasp is, PACE is a 50-year proven model that's produced better outcomes, lower taxpayer cost. So this is something that that actually lengthens people's lives when they enroll. There's very few things in healthcare that can do that the way that PACE can. Less hospitalizations, less readmissions, less depression, improved cognitive scores, less caregiver burden, high satisfaction, all at 10 to 15% savings annually over the equivalent cost of care for institutional nursing homes. So this is just an absolute win for everyone. It's a win for the participant. It's a win for the state and the taxpayers and their caregivers. The way that PACE works, which is I think just so beautifully designed, I can speak as his physician, is that it's a fully at-risk model. So the PACE program gets a capitation. So there's funding from both Medicare for those who are Medicare eligible, Medicaid for those who are Medicaid eligible. And with that pool of dollars, that PACE program has to produce better outcomes. And then the other beautiful thing about it is that the statute dictates that the rates that pay PACE have to be less than what the state would otherwise incur paying for the care in a piecemeal way or in an institutional setting. So by default, once you set it in motion, there's an ROI, there's a savings for the state. So I think the combination of those things makes the model work so well.
If I may, Mike, just jump in, I think one of the benefits of it, and that very well stated by the doctor as well as the governor, is we lose the delay in terms of the care as well because it's all integrated. You aren't sending in a request for orders or for a referral from a primary care physician, and then you're waiting a couple of weeks for the insurance to say okay, and then you have to get on the list, and then it takes you 4, 5, 6 months to get into that specialist or whatever. It's all right there. It's coordinated. It's in the best interest of the program to get the participant, to get the patient in as soon as possible, get them what it is that they need. You don't have to check 17 different boxes before they get the care that they need. And I believe that's what really contributes to extending the life and the quality of the life, because you're getting what you need. You're getting that patient care sooner rather than later. You're getting it at a higher level, right? And you're getting it in such a way that feeds you, right? That feeds you from a participant standpoint. You're getting cared for. You know you're getting cared for. The caregiver is getting the break along the way. But at the end of the day, I want my mom to get the best care possible. Now, it's going to take us a while, right? Mom isn't on Medicaid, but certainly she's on Medicare, right? I'd love for her to be able to benefit from this. But mostly, there's so many more people that don't have a daughter, that don't have a son, that don't have that capability. What's happening to those people? That's what we need.
Senator, so you're saying it's a policy that reduces time and bureaucracy,
yes,
reduces funding, and increases outcome of care.
How are we not doing this?
You're setting a pretty high bar for the next legislative session and what you've got coming.
I'm just saying, man, that how do we not do this, Mike?
We're going to get into the future of this program and how we're going to implement it when we come back on an all-new Nevada Newsmakers.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
No tricks, just treats at the Carson Valley Inn during the $100,000 Monster Pirate Treasure giveaways. Thousands in cash and free play giveaways every week. A monstrous $25,000 in guaranteed grand prize giveaways. Don't ghost these giveaways. Halloween awaits at the Carson Valley Inn.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org. Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
Welcome back to an all-new Nevada Newsmakers. I'm Mike Draper, filling in for Sam Shad. We're joined today by Governor Bob List, Senator Angie Taylor, and Matt Patterson, the president and co-founder of WelbeHealth. Thank you all for joining. I think it's been a great conversation. Governor, I'm curious, from your perspective, though, from a broader policy standpoint, as we've talked about SB 207 and the PACE program and all the things that it can do as far as decreasing costs and increasing outcomes of care, do you see this as a model that could expand at some point beyond elderly care into other vulnerable populations?
I suppose it could. It's a federal program, of course. The guidelines and the framework of it are dictated under federal law, and I suppose that it could at some point be expanded. I should mention that I'm a partner in Valor PACE, which is a company that does business, operates PACE programs in Virginia and in Oklahoma, and I've been on site at their locations, and I could see it being expanded to help younger people, for example, that are in poverty or somehow in need, and because it's such a caring program. It means so much to those who participate, and that would be a federal question.
This is Nevada Newsmakers.
It could happen at any time.
Senator, what were the challenges and kind of breakthroughs during the legislature in passing this bill? And then what are the next steps for SB 207?
The biggest challenge, honestly, Mike, was funding. As good of a program, actually as great, as phenomenal of a program as PACE is, it takes money to get it going, right? Ultimately, it's offset, right, and ends up saving us money, 10 to 15% down the road. But as we get started, even putting the RFP process in place and adding more work to the now health authority that we have, that Stacey Weeks oversees, and Richard Whitley, and all the things that they have to handle that at the HHS level, it would not have happened. We would not be here without the support of those two administrators, understanding PACE, doing their own research, understanding how we can benefit from it, and really saying, how do we make this thing work? Because the biggest barrier was funding, but really working with them really being willing to say, hey, this is how we can make it fit, right, in such a way that makes it make sense financially during a very tight fiscal year. Once we were able to kind of put our heads together, and when I say we, I really mean them, right? I've been there 15 minutes, so I don't really know how to do that much yet, right? But once they really dug in, made some calls to other PACE programs across the country to look at how we can do it, they were able to put together a strategy as to how we can put this in place and make it happen and get it going for us. So that was really the biggest issue. Unanimous support across the board. How do you not support this program? So I think those are the biggest challenges, and without that help from them, we wouldn't be here. Where do we go from here is really the first step is really the RFP process. Because we don't have an active PACE program, so now how do we put it out there? There are many vendors, as I've learned now, that operate PACE programs, right, in different ways in areas across the country. So how do we open it up and say, hey, who's going to get a chance to jump into this thing first as we get started? Do we start it with a pilot and do a couple, 3 programs around the state and see how it would look and things? So those kinds of details logistically. Is it divided up geographically so different programs can serve different zip codes so that people aren't overlapping with each other? Various ways to do that. How do we serve the rural population, right? Much more spread out, but that's a very vulnerable population, and those seniors certainly need this kind of care. So those are the things that the health authority, Stacey Weeks and her team, will be working out as we move forward. I would love the RFP to be ready tomorrow. Right, and Stacey knows that, right? I'm sure she's used to legislators saying, let's go, so that we can really get started on this. So those next pieces are, let's get the RFP out there. What does it look like? What are those program particulars, and how do we begin it? I'm hoping we can start with a couple, 3 pilots to get it going, see what it's going to look like. It will look different in Vegas than it will look in Northern Nevada, than it will look in the rurals.
There's people that need it right away, right?
Absolutely.
Gentlemen, I'm going to end. Go ahead, Governor.
I just simply would like to compliment the governor for standing up this new agency, Nevada Health Authority, and Stacy and her team, and Jensen and Kristen. They're doing a fabulous job of getting this all put in place and ready to roll.
Agreed, very much so. Matt, we've got about 30 seconds left. Let me ask you, from your perspective, what is the one thing or the most important thing that our viewers need to know about the PACE program?
Well, just that it's a program that can provide totally comprehensive integrated care for the most vulnerable older adults. There are 20,000 people in the state of Nevada who would benefit from this program today. Most of them, between Clark County, Carson City, Washoe County, and there's a 50-year proven model that improves the outcomes for these individuals. Let them age in place at home where they want to be, at a savings to taxpayers, and to put their support behind the state getting it up and going.
This has been a great conversation. I hope you all will come back on when we get the program up and running, and I hope that's a lot sooner than later.
Absolutely.
Thank you for joining us. Thank you for joining us on an all-new Nevada Newsmakers.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity and every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
Welcome to the Ahern Boutique Hotel, where luxury and warmth come together in the heart of Las Vegas.
We take pride in offering a one-of-a-kind experience for both locals and tourists.
Join us for handcrafted cocktails and an unforgettable experience. Joel's Chop House, the perfect place to savor views of the Las Vegas Strip.
Satisfy your cravings at the Ahern Chocolate Shop.
No smoking, no resort fees, and the parking is always free. The Ahern Luxury Boutique Hotel is your home away from home.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
The 13th Annual Nevada Newsmakers Goes to Washington is brought to you by Pro Group Management, workers' comp that works for you. NV Energy proudly serves Nevada, providing electricity to 2.4 million electric customers. The Nevada Mining Association, mining a better future for Nevada. Silver State Government Relations, we know Nevada, so you don't have to. And University Medical Center of Southern Nevada, offering the highest level of care in Nevada.
Thank you for watching and listening to today's Nevada Newsmakers. We'll see you on the next one.